Hi everyone, welcome back to part 3 of our screencast on global health for anthropology and world problems offered at Commonwealth University of Pennsylvania. So in this particular screencast, I'm going to go through some of the broad issues of study and then look at a couple of cases of work that anthropologists have done concerning health and medicine. So some of the issues of study would include health ramifications of ecological adaptation and maladaptation, popular health cultures and domestic healthcare practices, local interpretation of bodily processes. And you can think about all these things in the context of the COVID-19 pandemic, right? Changing body projects and valued bodily attributes, perception of risk, vulnerability, responsibility for illness and healthcare. Think about discussions of, the infected populations or the infected individual and how this compromised society as a whole. And I think we'll see in later sections in our discussions of crime and punishment and social inequality that you can make some of the same arguments here. Risk and protective dimensions of human behavior, cultural norms, and social institutions, preventative health and harm reduction practices, the experience of illness and social relations of sickness, the range of factors driving health, nutrition, and healthcare transitions, ethnomedicine, pluralistic healing modalities and healing processes, social organization of clinical interactions, so what's actually happening at the hospital settings. What's happening at the clinical settings? How are patients thought about? How are they conceptualized? How do medical professionals interact with one another? The cultural and historical conditions shaping medical practices and policies. Medical practices in the context of modernity, colonial and post-colonial social formations. So how things change in the context of development interests, rationalization, various colonial projects, ethnocentric policies, and then what happens in the gap when the colonist leaves in terms of nationalism and nationalist medicine. The use and interpretation of pharmaceuticals, IVs, different forms of medicine and forms of biotechnology, and also all the the beliefs that go into how those different substances were created and what they do to your body, the commercialization and commodification of health and medicine, disease distribution as well as health disparity, differential use and availability of government and private health care resources. And I think we see this with the discussion from the World Health Organization with vaccine equity, the political ecology of infectious and vector-borne diseases, chronic diseases, states of malnutrition and violence. And of course, all these things dramatically impact health, not only physical health, but also mental health and well-being. The possibilities for critically engaged yet clinically relevant application of anthropology. So a couple of studies just briefly here. Lyons' 2014 article, The Genocidal Virus, Addressing Belief Among Students of Color that AIDS is a Man-Made Disease. So Lyons begins with a discussion of various surveys of African Americans in the United States. And in a 2005 survey, one in 5 in a telephone survey and 1 in 3 of church members endorsed the statement that AIDS was a form of genocide against blacks. The connections were made there between past medical practices in Tuskegee, for example, where poor African American men were injected with syphilis, or they were, the idea that they were injected with syphilis, the lack of consent that actually went into that process. There was no informed consent. And they were essentially followed over time and not provided with proper medicine. The 2008 survey revealed that a majority agreed that there is a cure for AIDS, but it is being deliberately withheld by drug companies for economic motives. the societal perception of disease and epidemics clustered together because of the social position of those that suffer from that. So, very much a critical medical anthropology perspective here, if you remember back. The spread of HIV in Central Africa was an unintended consequence of mass immunization campaigns using non-sterile equipment. And then the HIV, substance abuse and violence of inner city populations. Lyons ends by noting, if concentration of HIV in specific population is shaped by policy, then the AIDS epidemic is man-made in that sense. There does not have to be a mastermind or single set of individuals with malevolent intent to produce an epidemic that is genocidal in a broad sense in its effects. Nighthouse's 2013 AIDS, Speech and Silence in South Africa looks at the use of speech and confession by South African NGO, non-government organization, Treatment Action Campaign, that was designed essentially to transform the stigma of HIV/AIDS into a badge of pride. The residents of this village in South Africa, Lobed, actually resisted this for the active use of concealment. In interviews with individuals, it was found that it was better not to test for HIV antibodies and know one's status. They weren't necessarily ignorant of biomedical knowledge, but the focus was more on prevention rather than treatment in public health campaigns. There was also concern over gossip, lack of a cure, and then a lack of easy access to treatment. Where in 2003, the only antiretroviral therapy available was some 30 kilometers away from the village that they were living in. So, this idea of accessibility to antiretroviral therapies. So in these three screencasts here on global health, we've asked some pretty big questions. And, we framed this in the context of the recently, and as of this recording, ongoing COVID-19 global pandemic and its vast implications in terms of education, health and well-being, including mental health, the economic fallout from COVID-19 as well. Lots of discussions about who has the power to determine what health is and how should this be addressed. We looked at medical anthropology as well and looked at what anthropology can contribute in order to try to frame the considerations of COVID-19. We also framed the discussions of COVID-19 in the context of ethnographic examples, as well as a discussion of other diseases. Thank you.